Good evening and welcome to Hello, It's Us, a program based on the concept that life goes a little better if it's all of us working together instead of you, me, and them working against each other. Hello, It's Us is brought to you by a collaboration of the Center for Disabilities and Development, the Extend a Dream Foundation, and all the hardworking folks here at Public Access Television, Channel 18. Tonight, as always, we've got my co-host Keith Ruff, and tonight we've got from NAMI Johnson County, June Judge and Della McGrath, who are going to talk some about the NAMI Walk, and we'll get into some other interesting issues besides. Welcome, ladies.
Thank you. Thank you for having us.
No problem. So, you're having a walk.
Yes.
You want to fill us in on all the pertinent details for that?
Our annual walk, which will be our 9th annual NAMI Walk, will be on Saturday, April 27th. It will be, once again, it will be in Lower City Park, starting near shelter number 6. It's a 5K walk, but there is an alternative if you don't want to walk that far, which is about 3.1 mile. You can walk the alternative 1 mile walk, which is just circling Lower City Park.
Okay.
And it starts, registration starts at 9 a.m. and the entertainment will start about 8:45, and program will start about 9:30, and then the walk itself starts at 10 o'clock. And usually everybody's pretty much done walking and back by 11 o'clock. And we do have refreshments also, and I mentioned entertainment, doggy treats. So you're welcome to bring friendly dogs along so they can walk with you too.
Friendly dogs.
We're hoping, we have a goal, we'd like to see at least 1,200 people there this year.
Wow. What's the average has been?
Last year we had about 800, and the year before we had a little over 1,000. So we think 1,200 is a reasonable goal to go for. This year, the honorary co-chairs of our walk are the 4 high school principals from the Iowa City area.
Okay.
John Bacon from City High School, and Jerry Argenbright from West High School, Ann Browning from Elizabeth Tate High School, and Glenn Plummer from Regina Junior Senior High School. They're our honorary walk co-chairs. And then we have our general/family team co-chairs, and June Judge is one of those. So that's why I asked her to come to be here with us today too. And Margalie Warner is the other one, the general family team co-chairs.
Okay.
And the business team chair this year is University of Iowa Healthcare, represented by Ken Cates, who is the Associate VP of U of I Healthcare and the Chief Executive Officer of U of I Hospitals and Clinics, and Dr. James Potash, who's the Professor and Head of Psychiatry at UIHC.
Could we have an idea of where the money goes that you raise?
Yes, yes. We have, NAMI Johnson County has a number of programs.
Oh, yeah.
Quite a list of programs, and we wanted to be able to tell you about those. June, you can help me with these, but just kind of, if you can chip in here also.
You're doing just fine.
We provide a lot of education. Probably some of our top programs, which is the programs are developed by NAMI National, and then we carry them out here locally. But the family-to-family classes.
And I will interject.
Yes.
I'm a family-to-family teacher, and when I've got my family in front of me, as Della said, I'm a family team chairperson, and so this is the family. And when my oldest son became ill with serious mental illness, as a teacher, trained, I looked for education to allow me to be the best family that we could be for my son, and we found nothing. There was nothing. And so we families joined together all around the United States, and we developed the curriculum. And it's from living with folks with a mental illness. And so this, as Della mentioned, it's a 12-week class. It is now evidence-based. That may mean something to you all. That means it's proven to be very effective and proven to be accurate. And we update it every year. And we teach to families who are not coping, but living with a mental illness in their family. And we feel that this is the best way to get information to the general public, because once those families take this class, the shame is gone. You realize that these are treatable conditions, and their recovery, we're working very hard for recovery. And so Family to Family, the class is very close to my heart, and we teach it all over the United States. And we'll be having another one starting in Johnson County before too long. But they're up in 12 of our affiliates teach Family to Family too. So back to the next one.
Okay, the next one I'm going to mention is peer-to-peer.
Okay.
And I'll let June tell you about that one too. The
Well,
peer class.
as we found when we were working with folks with serious mental illness, you know, all of us were in the same boat. We just thought all we ever knew about mental illness was what we learned from One Flew Over the Cuckoo's Nest, you know. We were scared to death, is what we were. And so when we were living with our loved ones, and here they are down here, oh my goodness, we found out that they not only had their intact abilities, but they needed support in order to use them. And we have found at NAMI National that our strongest groups are the consumer groups, the peers themselves. And they have developed now training for each other so that they're leading their own programs, peer-to-peer. And we have a wonderful woman here, Carol Porch, in Iowa City, who teaches peer-to-peer. And I can't tell you enough about the pride that I see from folks that have been traditionally ashamed of their own illness. You know, these folks, when they become ill with a thought disorder, blame themselves, or they think they're weak, or they've been told, you know, how it is, that they have no future. And so when you see them begin to help each other, now peer-to-peer at the state level and at the national level, these folks are being trained and are able to go into jails and prisons to give support to peers there in jails and prisons, going into the inpatient psych hospitals to be there for others who are just beginning a journey that these folks have already been on. And peer-to-peer is one of the strongest educational programs I have seen in the community for folks that have a very little understood illness. So, peer-to-peer.
We also provide hospital discharge program packets, educational materials on mental illness and support services that are available in the community or in their community and recovery. And those hospital packets are distributed at University of Iowa hospitals and clinics and at Mercy. And they have information in it for families.
So that's where some of the money goes, to these packets.
Some of these packets. And the packets are different. There's specific packets for the residents of Johnson County, and then there are packets that have information for people who are from outside Johnson County. The Tell Me Where to Turn booklet, NAMI coordinates getting that done. It's a joint project with a number of other agencies and organizations in the community.
Is that the big red one or the little
It's now orange.
orange one? Okay.
Yeah.
It's now orange. Oh, there's a big
Got
red
one
one
of those.
also. That's the big red brochure is the, what's the name of that? The roadmap.
Yeah,
The roadmap brochure is the red one, which is, that roadmap brochure is also one that NAMI provides, and that provides information on the services and problems addressed by mental health organizations to assist families in navigating the mental health system in Johnson County. Back to the Tell Me Where to Turn booklet, which the current one is orange, provides information about resources for mental health issues in Johnson County, and that one's available in a lot of places around the county. A number of organizations have that available, and we kind of coordinate it being updated.
And the biggest concern, though, for our families is insurance, because when our loved ones become ill, they're not eligible for many of the services that are in talked about in Tell Me Where to Turn, unless they become, get on Medicaid or other types of insurance. That's really a hot topic right now, is extending the Medicaid so that our folks can get mental health help. And so Tell Me Where to Turn is unfortunately not as helpful to those loved ones who are without insurance. Tragic, tragic. We have to work really hard to include insurance for mental health services in everything that we do.
NAMI Johnson County is also involved with the Lodge Model Housing Project, which is a collaboration of organizations to create a safe and independent but supportive housing opportunity for persons with mental illness. We're working especially with a shelter house on that program. We also have the School Project, which is a partnership with the Iowa City Community School District to educate staff, parents, and students regarding mental illness. We have a partnership with the Crisis Center on suicide prevention and crisis hotline. We work with them on providing programs as well as telephone support and referral system for mental health problems. We have little crisis cards. They're billfold size cards.
I'll leave some with
June will get one out here to show you. But it's got information on how to deal with a mental health emergency. You know, if someone has a situation, that kind of gives them some quick tips to look at what to do.
And you haven't gotten yet to the family support group. As far as every Thursday night from 6:30, here's our crisis card. And I will leave those here for you.
Nice and laminated.
Yeah, laminated even.
So that it will last.
And these are designed to help with anti-stigma. I'll leave a bunch of them out here, and we'll let the staff here have some too. But after the family-to-family class, we find that families need to continue to talk to others. And so every Thursday night at 6:30 at our NAMI office, 220 North Lafayette Drive, we have a support group. And these are the support group is facilitated by family members. We're not professionals. We're people that are continuing to walk the walk. And so that's available to anyone. You don't have to take the family-to-family class, but anybody that has concerns about their loved ones that may be having thought disorders are certainly welcome to come.
I can say where this would be really helpful for someone to carry in their wallet with them.
Right.
So if they get in a circumstance where they're unable to tell somebody what's going on, that having it in their wallet might give medical personnel or law enforcement or whoever a hint as to what they might be, where they may be able to turn.
Good thought, good thought.
I do know that the Cedar Rapids Police Department, during their training, they go over mental health issues. I don't know about Iowa City, but I know Cedar Rapids does.
Now, the Cedar Rapids, what type of training did you just say?
They go over how to recognize various disabilities, and among them is mental health.
Okay, and then what specific training is that? Is there a name for that?
I don't remember, but I do remember it's done before they officially become a police person.
Okay, okay, yeah.
Probably just part of
It's
orientation.
in the academy.
At the Iowa Police Academy, I
Yes.
did a
Okay.
family report on for
Yeah.
the Iowa Police Academy when I was part of Protection and Advocacy, which is now the American with Disabilities
Yeah.
group. It has a different
Yeah.
name. But because I had two sons who became ill, very big men, and when they have, they're under a delusion that can be harmful, the police are very much concerned as to how to work with folks like that. So yeah, training for police is part of what we want to continue to have done, especially in the Iowa City area.
Yeah.
Okay.
My dad was a Mason City policeman for 3 years and then a state trooper for 38.
Really?
And commented through the years that, and obviously especially after my accident, that the one thing that the police departments, patrol, sheriffs really didn't have enough training in was health-related issues, and you know, how do you recognize that, you know, this might be somebody in the midst of a diabetic seizure, or somebody who might be having mental health issues, or you know, any of a variety of things that the decision you make in the next few minutes, and you know, which path you start them down might be the thing that saves them long periods of wasted time someplace else, or maybe where they go to waste time.
Especially if a person is deaf
Yes.
and he's pulled over, and the cop did not sit there wondering why they're not moving. They're not moving because they can't hear.
Yes,
Well,
exactly.
You know, and that, circumstances like that, the person with the disability has a fair amount of responsibility
Yeah.
that to think ahead and have something
I agree.
that tells somebody what the issue is and, you know, what the problem is. With another group of folks, we do some disability awareness training for med students and nursing students in this. And one of the examples that we've used is for somebody who had cerebral palsy and was very hard to understand, and once went into a ER because they were having chest pains or something, and the staff couldn't understand him and kept trying to get information on who his guardian was. The individual didn't have a guardian, but because of the difficulty and there was no way to figure it out, it took like 2 hours before they finally figured out what was going on. And as I say, friends were describing this, and they knew him, and I said, so how's he taking care of that issue now? And they looked at me like I had two heads. What do you mean? I said, if this happens again, how are you going to tell? I don't know. How about a laminated card in his wallet that he could pull out and hand them? And the looks on their face was just priceless, because it was like, oh my God, how stupid are we? A little laminated card would certainly solve that problem.
Yeah.
We'll call him and find out. But you know, you need to take some responsibility if it's something as simple as that, or you know, diabetic, or whatever information you can give somebody who's attempting to help you to speed the process along, as opposed to waiting for 2 hours for somebody's guardian to show up when they don't have a guardian.
I agree, because I have a heart condition. But in my wallet, there's a laminated card with every medication I take.
What we would like to do here at the University of Iowa in the emergency room, so many of our people who have mental illness, the families are trying to get help for them, so they go to the emergency room. And these people can be acting out in many different ways. And some of our loved ones have had, you know, been self-injurious, and they come with the blood on their bodies and so forth. And so what we have worked with the university is to have a trained resident or a trained doctor who understands serious mental illness or psychotic episodes to be accessible, instead of having them wait in the emergency room along with other people and for hours even. And so you know, you talk about setting people up for ongoing problems. So we've worked to get a trained resident.
How awful would that be for everybody involved to be sitting there?
I've sat there many times with my loved ones waiting to get help. And now we have recognized that these are people that do need a specific type of training in order to cut through whatever you have to cut through to get them into psychiatric help, if indeed it's needed. and save lives and saves time. It basically saves
Sure.
time
And aggravation.
and aggravation.
Well,
Right.
and imagine the difficulty that you've had getting it done here at the University of Iowa. Yeah. Imagine somebody in Story City or LeGrand or some of these small towns that don't have hospitals, don't have doctors. And where do you go then?
They send them to Iowa City. That's what the state of Iowa does. They send these folks to Iowa City University, or they send them to Broadlawns in Des Moines if they're Polk County residents.
Yeah.
Now, I think in this new redesign, they're going to be looking at that, because here again, you're setting people up for much more problem than we should be. Having access to help, psychiatric help,
Yeah.
is something that we're all looking at now with the redesign. So anyway, it's not all this bad stuff, folks. We also, as Della has, we have game day, and this is put on by a young man named Ernani, who is here at the University of Iowa. He's in the School of Law, and he is very open about his bipolar illness. He was featured in Bipolar magazine. And when he had his psychotic episode, his family was told that he would never be anything, or they should be grateful if he could be a janitor. That's what he should strive for. Well, he's just getting his second PhD, and this one is in law. So Ernani is so good to give back to others, and he has a Saturday afternoon game day. And my family has gone to that, and it's delightful because we're not all gloom and doom, folks. And Ernani with his game day is one of our delights,
And where's that happen?
I think it usually is at the Iowa City Public Library.
Yeah,
Okay.
Iowa City Public
On
Library.
one Saturday a month.
Yep, and you come in and you see the sign on the door. And believe me, we say mental health or mental illness because we're not ashamed. These are treatable conditions, and they're very normal, very common. And so people can come in and join us, that even if they don't have a mental illness, even then.
There you go.
I think that's a better idea, because the more the common person understands the issue, the better off we all are.
Yes, I agree. So where are we on
One
our
of the
list?
other projects that we have ongoing is we have a monthly program. We have a monthly program meeting on the third Wednesday evening of each month at 6:30 p.m. at Mercy Hospital in their conference room. There's a monthly program put on a different subject every month. It comes out in our newsletter. We have an email newsletter that comes out too regularly that lets everybody know, anybody who's on it, and anybody can be added to the list for it to receive it. And find out about what the monthly programs are or whatever else. There are many different subjects that are covered in those emails, so anybody can get added to that email list. Just call the NAMI office at 337-5400
That's a good one.
and ask to be added to that email list for the newsletter so they can find out about the monthly programs that are going on. And prior to that program meeting, there's usually a family-to-family gathering.
We
and a
have two
peer-to-peer
support
class.
groups. We have a peer support group for folks that are consumers of mental health services, as they have a wellness recovery program that they're actually doing together. They're it's NAMI Connections. It's kind of like an AA for folks that are taking mental health services or having mental health services. But it's a very supportive group, as you can imagine. People are so glad to know that some things they may be experiencing are something that others are experiencing. They're not alone. So there's the consumer group that's run on the same night as we have our educational meetings, and then we have a family group that's also the same type of thing, that families who don't necessarily have to be NAMI members, that are just interested in either sharing something that they are concerned about or finding out more about mental illness. It's open to everyone, certainly open to everyone, for families.
And I think peer support is becoming such a key in any kind of a situation. We didn't call it peer support back in 1971 when I broke my neck, and we had monthly meetings or weekly meetings with the two rehab floors at the hospital. But that's is what it was. And yeah, it is, I don't know if I call it calming necessarily, but it has an effect when you listen to other people talk about issues they're having that either you've gone through yourself, or it's easy to anticipate that this is coming down the road, and it gives you a clue of what to do if that situation should occur.
It's kind of like clearing the air, making it more viable.
Yeah. And it's a whole lot easier to accept coming from somebody in the same situation you are as the charge nurse, or this person with all kinds of letters in back of their name, but what do you really know about it?
That's true.
NAMI also provides scholarships, stipends provided to families and consumers to attend conferences on mental health. And they have lots of brochures that we get from NAMI National or NAMI Iowa on that are placed out in different agencies and the libraries in town, in the area, and counseling offices and businesses to inform people about NAMI and our services. And
And we have a library, and we have found that when families are first concerned about what they're seeing in their loved ones that may be unnatural or bizarre thinking, the first thing they do is go to their clergy, if they have a church, and the second thing they do is go to the library, and now it would be go to your computer and look up things. But we have quite a nice lending library, and we have books that have been donated by families that have been, these books have been especially helpful to them for certain reasons. And we just had, Della just talked about this young man that was here as a veteran, and he had his service dog with him. And he had PTSD, post-traumatic stress disorder, and so Della was talking about his book that was Welcome Tuesday, I think was the name of the book, and it's been donated. It's been donated to us.
Yes.
Anyway, I saw it again at the library.
Until Tuesday.
Okay, until
Tuesday, right.
Yeah. And then, of course, yeah, go ahead.
Yes, well, I want to make sure we get in about the walk.
Yeah,
some more about the walk, too. The walk is on Saturday, April 27th at Lower City Park. You can go on the website and register to sign up for our walk. You can go on and register a team, or you can sign up for a team that already exists. You go to www.namiwalks.org and click on Iowa and Iowa City and sign up for the walk. Either sign up a walk team, or as an individual, or on a specific walk team, or start your own walk team. And I wanted to emphasize that there are three purposes for the walk. One is to raise money for all these projects and programs, and we have a long wish list of things we'd like to do too if we ever raised enough money. So that is the purpose of raising money from the walk, is for those things, all those projects and programs. But the other purposes are, one, to raise awareness of mental illness, make more people aware about mental illness and how prevalent it is, how many people are affected by it. And thirdly, the other purpose of it is to reduce the stigma of mental illness. Get everybody thinking about it as any other illness. It's treatable. Just have to make more people aware of it and how common it is, and not be afraid to go and get treatment.
And to be proud,
Well, we've used up our time for this segment. We want to thank you so much for coming on and sharing with us, and we encourage everybody to go out and get involved in the walk. And if you have any questions, get hold of these nice folks at NAMI. And until then, we'll see you next week, and hopefully we have proven that us is better than the other way.
Thank you.
Take care.
Thank you.